Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today's topic is in vitro fertilization. What is in vitro fertilization, or IVF?
Sadly, about 1 in 8 couples have difficulty achieving the family that they want to have. And back in the sad days, back when I was in training, we really didn't have any treatment that would help them. But now we have a treatment that succeeds about 35 to 40% of the time in helping a couple have a baby, and that's in vitro fertilization. And basically what we do is we just give a woman medicine to help her stimulate her ovaries to make eggs. We take the eggs out, we put them in a little laboratory in a little petri dish, we add the men's component of that. We grow these little embryos for a couple days and then put it back in the woman and she becomes pregnant.
What advances in IVF treatments have been made since the first IVF baby was born 40 years ago?
So it's been around, but the science behind it was not very well perfected until fairly recently. We had no way to treat men who had decreased sperm issues. And so we really found ways of optimizing chances for couples achieving their family goals. If you look at the causes for not being able to achieve their family goals, 40% are because of the woman has a health issue, 40% are the men, and 20% are what we call unexplained, so we don't have a reason for it. And so it's kind of mixed between men and women.
What steps need to be taken before IVF treatments start?
Well, typically what they do is they try for a year. That's the standard. And if they don't achieve the pregnancy they're hoping for, then I would see them and I do a basic, really basic evaluation to look if there's something with the husband, something with the wife, or again, if it's the unexplained. So we do a very basic workup. It only takes a month to do that. Then there are other treatments. None work quite as well as the IVF, but there are other treatments. We discuss those options, and then they decide what they want to do.
Can stress play a role?
We don't think that the stress causes infertility, but infertility, not being able to achieve pregnancy, definitely causes stress. And we do have a psychologist who works in our office and talks to couples because it's one of the most stressful disorders there is. Some studies even show it's more stressful than cancer.
If IVF treatments fail, can you try again?
You can try again, and people will. And the good thing about Massachusetts is this treatment is covered by insurance, and most insurance will cover it up to 4 times, and some even more. Now, the other good thing is now the little embryos that are of good quality, if you grow several and put back one, we only put in one, we try to avoid twins when possible. We put in one, then good quality ones can be frozen, and that gives a second chance for pregnancy.